For lots of Americans, a primary care doctor is the first person that you call if you have a non-emergency medical issue. Yet, you might be surprised to learn that there's a lot of folks who do not have a primary care doctor, particularly if they are younger. And that's a problem, writes our next guest. Jordan Roberts is the healthcare policy analyst for the John Locke Foundation. He has been writing about the importance of primary care. Joins us now to talk about that. Jordan, welcome back.
Thanks for having me.
In the column that you wrote, which is posted at johnlocke.org, one of the things that you wrote I thought was pretty fascinating. You said that primary care has a profound impact on a person's life for many, many years. Mm-hmm. How so?
Well, your primary care doctor is your point of contact in the medical field, and they're the sort of gatekeeper that keeps allows you to access care and helps you get any other care you might need outside of a primary care setting. And so, it's so important to have this relationship with your doctor for a long period of time because they can understand your conditions and understand your all different kind of ailments you may have, and they can help best serve you. And that's why it's so important to have this doctor-patient relationship with your primary care doctor, because they essentially are your gatekeeper for everything else, and they have the most experience with you in terms of your health care. So it's just hard to understate the importance of that.
So it sounds like they're really the foundation. And in my mind's eye, Jordan, I kind of picture this almost as a hub and spoke system, in that the primary care doctor is the hub, and then the spokes go out if you need specialists or additional types of care. It's that primary care doctor who knows you intimately and can then assess and recommend so that you can go forward and have specialty care.
Yeah, that's exactly right. And so, that's why it's so important to maintain that relationship with your doctor and make sure to be honest about all your conditions and symptoms and everything. And, this has a profound effect on healthcare spending later in your life, the prevalence of chronic diseases, things like this. So, establishing that relationship with your doctor at a young age, keeping up, maintaining that relationship, like I said, it's hard to understate the effects it has on one's life.
Despite all of that, though, you have found that there are many people who don't have a primary care doctor, particularly younger people. What's going on?
Well, yeah, that's what the data is showing, that, there's been a slight fall off in the number of people that are accessing and have a primary care doctor in a number of recent years. And, it's particularly with younger folks because, as a younger person myself, maybe if you're feeling pretty healthy, you say, I don't need to go, get a physical, see my doctor. I don't need to pay that copay, things like that. But, it's like we talked about before, it has profound effects on later in life if you, maintain that relationship and keep up with all of your just vitals and everything you need to be a healthy person.
So, Jordan, does that mean that we're talking about people who don't have health insurance, or is it people who maybe say, gee, I'm feeling pretty peaked today, and rather than go to a doctor, I'm just going to run down to the CVS that has someone there, or maybe they run down to an urgent care. Is it a little bit of both?
Yeah, a little bit of both. Some people just may not have insurance, so and a lot of primary care doctors, you need insurance to access that, or a lot of people my age just, they may be very healthy and they know that they have health insurance and they can use it anytime they want. But, is it worth the time? Is it worth, the exposure in today's world? And, is it worth that money to go and see when you may think you're all set? But
that insurance point is a fascinating one because let's harken back to, oh my gosh, it's been probably a decade now. Obamacare, the Affordable Care Act.
Yep.
Huge debate, big Supreme Court decision that says that, yes, it is constitutional. Wasn't Obamacare supposed to take care of this problem, all of the uninsured?
Right. And, what we've seen is that it did, extend health insurance to a lot of folks, but not nearly the type of comprehensive universal coverage that was promised. And what we've seen is it's just driven up healthcare costs, including for primary care. And, that's, when we have a health insurance system that makes it harder for people to access the healthcare system, we really got to ask ourselves, is this system really working the best for Americans?
We have people then who are choosing, or maybe not choosing, just circumstances are dictating that they don't have a primary care doctor. Jordan, are there enough doctors to go around? Should everyone decide, hey, that's for me, I need to choose a person?
Mm-hmm. Well, that's another thing that we've seen in the data, and that a lot of projections show that we're going to have a serious shortage of primary care doctors currently, and even more so in the future. And one of those reasons is that, a lot of testimonials from primary care doctors will say that they're just burnt out, with all the insurance paperwork and everything else that they have to deal with to get paid, and how little time they can actually spend with their patients because of the system, the third-party payer system we have. And so that diminishes the doctor-patient relationship. Doctors feel like they don't have control over their patients. If they're part of a larger hospital system, they may have to, operate under the policies that the hospital dictates. They may not be able to practice medicine the way they want. And what that leads to is people choosing not to go into primary care once they leave medical school, and maybe choosing to go into specialty care. So this is a big problem that we're going to have to deal with, and the projections are paint a very bleak picture of primary care in the future.
Well, that's unfortunate, but I'll tell you what, as we talk a lot about here at the John Locke Foundation, innovation naturally occurs when we meet a challenge.
Mm-hmm.
And in fact, that whole insurance web has now led to a new type of primary care. It's called direct primary care. Tell us about that.
Yeah, so direct primary care completely bucks the third-party insurance third-party payer insurance model. And what it does, doctors who participate in a direct primary care practice, they do not accept insurance. They contract directly with the patient. And what this does is it significantly decreases the price of primary care. And so, the way it works is it's sort of like a gym membership. An individual or a family would pay a monthly fee to the doctor in exchange for around-the-clock care. And what we've seen is, as more doctors, like I said, get burnt out from all of this, the insurance web they have to deal with, a lot of them are switching to this direct contracting model where they contract directly with patients, and they can get paid that way. They don't have to worry about insurance payments, and they can spend more time, manage their patients better, save money, and create better health outcomes. So there's a lot of benefits of this model.
If someone chooses direct primary care, let me propose this scenario to you, and you can tell me if this would work or not. Mm-hmm. Let's say that I have health insurance, but I don't want to access that insurance just for a cold, a cough, something like that. Could I essentially kind of save my health insurance for something serious and go ahead and go outside the insurance system and just set up a direct primary care relationship with a doctor just for the basics?
Well, if you were to contract with a direct primary care doctor, normally what you would do is you would have a high deductible health plan, and you would pay for the out-of-pocket expenses of the direct primary care.
Okay.
Yeah, so it'd be.
So it's a different type of health insurance that would couple up with your choice to choose direct primary care.
That's correct, because the direct primary care doctors don't accept insurance, so your comprehensive health insurance would be no good in this arrangement.
And lastly, Jordan, just a question about the issue of downward pressure on the cost of health care. What about direct primary care and people needing to choose a primary care doctor? Does that help us control costs?
Well, if as the direct primary care profession grows and more people are starting to realize the benefits of this, what it could do is, as the traditional comprehensive third-party payer model starts to decrease, or people start to use it less, then certainly there'll be more competition among providers, and especially ones that can offer this very affordable model of direct contracting. So it certainly will instill some more competition in the market, and hopefully that's what will drive down prices.